So in this video, I'm going to talk about the pneumomediastinum, and we will see the streakulocencies. We can see the spinnaker sail sign, and we will see the nectary of B sign, and we will also talk about the causes of pneumomediastinum. So let's jump into the study. Okay, let's see the what is pneumomediastinum first. So pneumomediastinum simply means that air in the mediastinum, right? So normally there is no air in the mediastinum, but due to any pathology, if there is there is air in the mediastinum, we will call it the pneumomediastinum. So let's see the case of pneumomediastinum. This is an X-ray of peculiar X-ray of a pneumomediastinum. So first compare it with the normal chest X-ray. So there is a normal chest X-ray, and we can see that in the mediastinum, this is the mediastinum part of the chest X-ray, and mediastinum part of the chest X-ray, and we will see that this part of the chest X-ray is opaque and there is no lucency in this area because this is the heart here, and it is full of blood, and the blood in the X-ray is opaque. There is no lucency. But if you see this X-ray of pneumomediastinum, we can clearly see these streaky lucencies here. Okay, you can see these streaky lucencies, and these streaky lucencies are marking the blood vessels here. Okay, and this is called this is the streaky lucencies that will give you the idea that this can be a X-ray of pneumomediastinum. You can also see that in this chest X-ray, the central tendon can't be marked. Okay, you can see that the diaphragm here is the hemidiaphragm, and there is the right dome of the diaphragm, and this is the left dome of the diaphragm. But the central tendon cannot be marked because the heart sees into the central tendon, and the heart is opaque, and the central tendon is also opaque, and so there is no differentiating point between the or line between the heart and the central tendon, so it can't be marked. But you can see that in here, this is the right dome of the diaphragm and this is the left dome of the diaphragm, but you can also see that the central tendon can be marked or different, or it can be differentiated by a line of lucency. Okay, so this is called the continuous diaphragm sign, where the diaphragm is continuous. Okay, so it is continuous diaphragm sign. Okay, and you can also see that in the normal chest X-ray, we can outline the descending aorta. This the descending aorta, the aortic knuckle. The descending aorta can be outlined to some point, okay, and not the full extent above the diaphragm. Okay, but in this a case of pneumomediastinum, you can clearly identify the descending aorta through its clearly identify the descending aorta above the diaphragm through its course. Okay, so because it is lined by the air. Okay, so the descending aorta is lined by the air, and you can clearly identify its root above the diaphragm, and this will give you a proper diagnosis of a typical pneumomediastinum. Okay, let's see this case, and you can see that this is a case of neonatal pneumomediastinum. Okay, so we know that in neonates the thymus is large uh, uh, relative to the other organs. So when the air is into the mediastinum, it pushes the thymus away from the central and away from the center, and it pushes it to the sides, and you can see the thymus. Okay, and this thymus is kind of look like the spinnaker sail. You can see this spinnaker sail in this picture, and it is quite similar to this thymus, and so that we call it the spinnaker. Okay, spinnaker, sorry, spinnaker sail sign. Okay, now let's see the Naglerios V sign. Okay, this is the Naglerios V sign. You can see that in this chest X-ray, you can see that there is a lucency similar to the V. Okay, there's a lucency similar to the V, and it occurs when the esophagus ruptures. Okay, when the esophagus ruptures, the air from the esophagus comes into the mediastinum, and it outlines the descending aorta and also the diaphragm. Okay, and this gives a shape of V, and it is called the Naglerios V sign, and it is typically seen in the esophageal rupture. Esophageal rupture, but it is not a complete diagnostic of esophageal rupture, and it is not so much useful. The Naglerios V sign is not so much useful. Okay, so let's see the causes of pneumomediastinum. So what can be the causes of pneumomediastinum? It can be traumatic. Okay, so firstly, in any blunt chest trauma, it can, or penetrating chest trauma can cause pneumomediastinum. Okay, so blunt chest trauma or penetrating chest trauma causes pneumomediastinum. Then there is the esophageal rupture. And it gives the Naglerios V sign, and then you can see that the asthma or COPD or severe coughing can also lead to the pneumomediastinum, because it causes rupture of the alveolus. Okay, so when the alveolus rupture the rupture of the alveoli, the air into the alveoli pass through the bronchovascular sheath and gets into the mediastinum, and it is called the Maclean's effect. Okay, so and also bronchoscopy or endoscopy can also lead to pneumomediastinum. So that's all for this video. Thank you.